Hi guys, I wanted to talk to you a little bit about how to modify core exercises during and throughout your pregnancy. First off, after your first trimester, you're going to want to stay off your back, so no crunches or things like that. But there are ways that you can modify these exercises or do similar exercises without being flat on your back or in the supine position. And one of those ways is to prop yourself up on your elbows. So just lift your torso up with either a pillow or prop yourself up with your elbows. You can also do the same or very similar exercises from a seated or a standing position. So instead of bicycle crunches on the floor, you can do standing bicycle crunches, standing regular crunches, knee lifts, seated knee lifts, things like that to work your core without being flat on your back. Another position that is pregnancy approved is side lying, things like side plank, side crunches. So if you're laying on your side and not directly on your back, those are also, it's another great way to modify core exercises. So one thing I do want to say is just anytime you're doing pelvic tilts, just kind of watch, make sure it's not quite so, you don't need such a great pelvic tilt, kind of come more from the abdomen than necessarily the glutes, and just kind of lessen that range of motion, but just listen to your body. Your body will tell you. So, if something doesn't feel right, then modify or stop doing that exercise. Another thing that I want to talk about is plank and the quad ped position. So planks are also an excellent way to work your core during pregnancy, especially in the first trimester. However, once you start getting bigger, baby starts getting bigger, it can start putting strain on your back, and you also don't want to risk having the ab separation with the diastasis recti. So basically, if you need to modify, go ahead, drop to your knees. You can do an incline plank off a bench or even a wall. So just that kind of is going to depend on you and what your core strength is to begin with. So if you have a strong core, you've been doing planks this whole time, you probably won't have as much an issue as a complete beginner. So just kind of listen to your body, and then also look for coning. So if you see any coning where the belly is kind of bulging out or in a cone shape, that's a sign that you want to stop and not do it because you're putting too much stress on the abdomen. So, you can continue doing your planks in the second and third trimester. Just listen to your body, modify if you need to, go to your knees, do an incline, or if you see coning, then go ahead and just pick another exercise to do. Same thing with the quad ped position, which is the all four position. It's great to do exercises like bird dog or things like that. It's a great alternative to being on your back, but once your belly starts getting a little bigger, heavier, if you start straining on your back, just watch for any coning or any stress on your back as a sign that it needs to be modified, or maybe just skip and go to standing type movements.